On Thursday. But joining us now, Starla Brown, Mississippi State Director for Americans for Prosperity. Starla, good to have you on Middays. Thanks for coming in.
Hey, Gerard. It's great to be here today on this kind of cold and dreary day, but we're doing okay out there. It didn't ice over, so I think that's a plus for Mississippi today.
You don't get this in Florida. That's where you came from, right?
Yeah, well, yeah. But I've been through a few ice storms in my early days back here in Mississippi.
Okay.
So, yeah.
Okay.
So I'm adjusting, though.
I got you.
I'm adjusting. So.
All right, so tell our audience about the organization AFP, Americans for Prosperity.
Sure. So Americans for Prosperity is part of the Stand Together community, and we are one of many nonprofits throughout the organization, sometimes all rowing in the same direction, but different approaches or pieces of how we do that. We sort of kind of mark ourselves on 4 pillars of society, which we believe are key institutions, right? And institutions don't necessarily mean brick and mortar. They mean the things that make them up. And so government is one, and that's primarily where Americans for Prosperity focuses. But we also have community, education, and business. And sometimes there's some overlap between how we work in those other pieces, but primarily we focus on that policy and government piece and trying to get policy across the line that we believe is going to break the barriers to opportunity for the people in the states where we're working, and also create opportunity for everyone. So it's not about carving out something for special interest or sort of that notion of cronyism and that type of thing. It's making sure that everybody is included.
Sure. What's on your radar for the upcoming 2023 legislative session? They'll be down at the Capitol gathering up there in 2 weeks from today.
That's right. Yeah, we'll be down there. We'll be there every day. We got an office near the Capitol, so we'll be working primarily out of that office and across the street. But a couple of different things that we're looking at. Healthcare is one of them. So if you look not only at the state level but the federal level, there's a lot of policies that can mirror up to each other. And as we move down the next couple of years, and even this year, 20% of the GDP by some studies is spent on healthcare in the U.S., and so that's a huge number when you're looking at that. One of the things that we've been kind of heralding at the federal and state level is what we call the personal option. We actually have a website, personaloption.com. You can go there and take a look at this, but on our legislative agenda. So there's a series of different things. The problem with healthcare is we're always looking for the silver bullet. And a lot of times that silver bullet looks like Medicaid expansion. Mm-hmm. It looks like a top-down approach to and government-run healthcare as the only opportunity. But there are many, many pieces out there when put together that are patient-centered, with doctors and patients being able to make those choices. Then we kind of come together with something that we call the personal option. One area in particular that we're working on is the certificate of need. Mm-hmm. So, look, I'd love to see all of the pieces of certificate of need the state removed, but right now we're focusing on mental health and substance abuse facilities. And for those people who are not familiar, which I find around the state, that when we're talking about this is, this is a permission slip from the government to do business or to open up a facility.
Right. Talking about a certificate of need.
Yeah. Mm-hmm. And so we'd like to see that. We'd like to see those removed. But the one piece that we will be working very heavily on this year, mental health, if you were or have watched the Judiciary B, the subcommittee on mental health, and the different people presented, one of the things that we're finding is whether it's hospital CEOs or it's law enforcement, they're absolutely inundated with people in the hospitals and jails that are coming in for either substance abuse or mental health, and it's a weight on those facilities. So we're hoping it's a very simple bill. Just remove that to those 2 pieces there from certificate of need. I don't know if the floodgates will open, but the opportunity for people to come into the state and create more beds and more facilities to help with this crisis. And I use the word crisis because if you listen to the data and statistics that were presented, we do have a mental health crisis here in Mississippi, and one of substance abuse. And, when you compare that to criminal justice, which is another piece we're going to be working on, and we're going to be focusing on violent crime. So that may seem a little outside of what we've focused on in the past, but we've got 4 principles. One is the properly funding the police. I use the word properly, right? So there's a lot of things police need, whether it's training, better use of things that they can do that in the community programs, focusing on their time and resources in preventing violent crime. Often when you see something like some law enforcement office saying 70% of the people incarcerated in our jail or our prisons, facilities have this type of mental health issue, they're encumbered with that, and they don't have the ability to spend the time on and actually reducing violent crime, which is something we sorely need. We see that. I think in 2019, there were just over 10 million arrests. It's about 13% of those arrests were actually around very nonviolent drug possession charges. So they're dealing with a lot of things that are taking their time. We also want to focus on what we call an evidence-based approach to reduce violent crime. We need to know the statistics. We need to know what's happening in our communities and where and why. And then we want to continue to enact smart on crime policies. These are alternatives to incarceration that make sense. And one of the things that we've got to remember is that there's a judicial piece to this. So we don't want to be like New York, where we put out a very broad, sort of, I think a lot of people would refer to it as a get out of jail free card. But we don't want to have that broad policy, because that's a one size fits all approach to reducing violent crime, and it just didn't work in New York. It's had some terrible results, and we don't want to see that here in Mississippi. What we want to see is the judicial process work as it should, where judges can be judges. And so that's another piece that we're looking at. I think when we refer back to healthcare, one of the things that we've seen is what we call full practice authority.
Right.
So your nurse practitioners, your physician's assistants, you'll see all of this on our legislative agenda at thepersonaloption.com, but allowing those individuals to practice fully what they've been trained to do will help immensely make healthcare more accessible and affordable.
Try to get some progress on that this past session. Correct. I think got a little bit, but not totally there yet.
Right. There's still a collaborative piece for nurse practitioners that we'd like to see removed.
Explain that for our audience.
So for the audience, nurse practitioners within a certain mile radius can practice sort of autonomously, but they have some reporting and things that they have to do back to a physical doctor. But that includes some very large fees. Some of the reporting, I would say, based on the discussions that we've heard with different nurses or facilities, is that it's very minimal, the work that's being done, but they're incurring sometimes as much as a $5,000 fee.
Yep.
And in these rural areas where we need more health care, nurse practitioners setting up and being able to just simply do what they do. Obviously, if it's outside their scope of practice or what they're trained to do, obviously they need to send those people elsewhere.
Yeah.
But as we look at all the hospital closings, as we look at all of the inability to pay, nurse practitioners, one thing they can actually offer that we think is great, and doctors and hospitals could do the same, is price transparency, right? A lot of people don't get treatment sometimes that could prevent longer term disease because they're afraid of the cost, right?
Yeah.
They don't know up front what they're going to pay. And sometimes even with insurance, that's the case, right? So these are the kind of things we think that when you add it all together, telehealth, when you add in all of these different pieces, if we get all of these things together, then we've got our silver bullet, right? We've got a more focused, patient-centered type focus with healthcare, and that's what we're really looking to do, not just at the state level, but the federal level as well, and not take the mindset that this top-down approach of let's just throw some more tax dollars at a broken program like Medicaid. That's something that
Yeah, so Dr. Edney, of course, with the Department of Health, reports that there are some 54 rural hospitals of the total 122 in the state. Says that more than half of them are in crisis-level financial condition. So not sure what the government, if at all, intends to insert themselves into that situation and address it. But we're up against a break right here. I know you got more that you're working with the legislature on. We'll come back and talk about that if you're available.
Absolutely.
All right. We got Starla Brown, Mississippi State Director for AFP in the Element Well Studios. Coming right back. We're talking to Starla Brown, Mississippi State Director for Americans for Prosperity. All right, so yeah, healthcare, no doubt, has got to top the list. The Certificate of Need laws are archaic, been around for quite some time, and there are powerful lobbies that want to keep them in place, as you well know. But it's contradictory to a free market as much as anything I can think of. And you're absolutely right. The healthcare, what's called the healthcare economy, as you know, the HCE,
right,
is what economists and those in the industry refer to it as, the acronym, the HCE. It's about 20% of the nation's total GDP, sits at about $6 trillion, just under $6 trillion, which is incredible when you think about it. It's a big part of our economy here. 122 healthcare institutions, many of which are really struggling to make ends meet. And even Dr. Edney has said, Medicaid expansion might help a little bit, but it's not, as you called it, the silver bullet. But the fact is, we still have a lot of folks in here that are in the Mississippi who are uninsured and who are receiving care that is uncompensated, not paid for. Mm-hmm. I don't know what the solution is to that. I can share this anecdotally. I'm approaching the age where I'll be eligible for Medicare. So, of course, I started looking into that, researching that. I could not believe how expensive Medicare is, because base Medicare, Part B Medicare, really doesn't provide coverage, certainly not equivalent to what you're used to in a typical group plan that your employer provides. So when you supplement that with all the other coverage, for my wife and I, it's $1,500 a month. It's $18,000 a year under Medicare.
Right.
I just blew me away. So I start thinking about now it's income tested, as you know.
Right.
So I'm blessed to have the income to such that I'm going to pay the maximum amount. But it's still ridiculous. It's expensive, and a lot of people just flat out can't afford it. Period. I don't know what the solution is for that.
Yeah. So, one of the things that we've looked at, and maybe it's not so much when you're approaching that age, but we've some people call it concierge service was a more common term, but direct primary care. And there's a lot of doctors out there who are modeling some really wonderful practices. They're able to make money, they're able to compete, and they're able to provide because they're out there operating as a business. They're creating contracts with, I use an analogy that I used not too long ago. So I had a friend who decided to go direct primary care, little catastrophic insurance, and that was healthcare based on age group and health and that kind of thing. And had the options to choose what makes that up. Looked at a health savings account as well, right? But that still needs some work at the federal level to get people where everybody can access it. So one of the things that I found was if I went to get an MRI with my insurance policy and all intents and purposes looks like sort of a typical Cadillac insurance policy. But if I went to get that, the MRI was a couple $1,000s that we were talking about. Mm-hmm. In their case, because of the contract the direct primary care doctor had with the laboratory to send all their business there and to work through that, they paid $87 for an MRI. Yeah. So there's something wrong, and a lot of people will say, well, you can attribute that back to the health insurance market and the middlemen and all these different things. But there is something wrong with the way we do business. I talked a little bit before the break about price transparency, right, and how that would help some people actually determine what they could afford and what they could do. And one of the things that somebody asked me, well, what do you mean by price transparency? And I said, well, look, it's Christmas time. You're getting a lot of mailers, right, in the mail. Everybody's got similar products at similar department stores, and each one's running their stuff for a different price. If doctors and hospitals had those same sort of scenarios, and you could say, well, gee, I'll go over here and do my business because it's going to cost this much at this doctor or this hospital to get this procedure done, you'd be shopping the same way. Competition isn't a bad thing if at the end of the day you believe healthcare is about the patient, their relationship with their doctor, and the ability for them to access affordable quality care. If you're lobbying otherwise, because the patient is the number one piece in this, and healthcare for individuals is not number one, well, then you're probably lobbying for something else, and it's not a free market principle.
Yeah, it's got to be the only commodity that consumers are ever faced with purchasing, that there are multiple prices for the same service.
Same service, exactly.
I mean, I described it. It'd be like walking into McDonald's and you look at the menu and the price of a Big Mac, and there are 4 prices depending on who you are and who's paying. Essentially, it's the way it works, and
exactly.
You scratch your head. And it's broken. There's no doubt about it. And but policies that involve more government, no doubt, sort of amp up the defects in the system.
Sure,
is what happens.
They're gonna exacerbate an already failing system.
Yeah.
And look, there's a point in time where these failures are coming. I mean, this is going to happen. It's not a matter of offsetting something immediately, but I think in the interim, I ask the question, what's the worst that could happen if you removed a certificate of need? What's the worst that could happen? Somebody comes in with a great model and does a great business, or they come in with a model and they fail. We're already failing a lot of models right now. So I think the idea here isn't about, and bottom line, government shouldn't be giving that permission slip, a permission to care, as we call it sometimes, right? And so, when it comes to the mental health facilities, so needed, and we know we have this crisis, right? Why not just move that piece out of the way? What if there are those organizations, that want to come in and provide services and feel like they can do that in some way? What's the worst that's going to happen? We have some more beds.
Totally agree.
So
totally agree.
So it's kind of to me, an illogical argument to have, but
it's not a whole unlike the whole licensing system in the state, where you got to go to your competitors to get permission to compete with them, essentially. So that makes no sense whatsoever.
Yeah.
What else is on your radar coming up?
So education, what we call foundational education, that K through 12 sector is also on our radar. Looking towards something called dual enrollment, and we'll be rolling out some stuff here in January. Probably catch some here on SuperTalk and a few other media places. But we're talking with actual students in other states who have dual enrollment. And what we're finding are these phenomenal stories about how much dual enrollment helped them, whether it was with the cost, how much it saved them for the cost of college, how much it allowed them to get a jump start in their career. When you look at the fact that not every student is going to go to a 4-year university, there's a lot of programs out there, and Mississippi has a wonderful community college system. We always have. I attended it myself years ago, and I believe that we look at these shortages of like healthcare workers, right? Why not let students that are going to pursue some of these different areas that's not a 4-year university get that jump start on their career, or even on their college classes to further them along. And so we're excited about that, and we'll be talking more about it, and hopefully educating the public on what exactly it can look like, and what it looks like in other states, and hearing from kids who've actually been through the program. So we're excited to share those stories. We continue to sort of beat the drum for the elimination of the personal income tax. It's obviously we're looking for legislation that doesn't have tax swaps in it, that doesn't, kind of beg from Peter to pay Paul, as we say, right? And goes over here to increase a tax here or there to offset something. If it makes sense, and Mississippi is going to continue to attract businesses and thrive, businesses need a couple of things for sure. They need an educated workforce, but the lower taxes is also very attractive for businesses to come in our state. And one of the things that Mississippi needs, obviously there are certain sectors of jobs that are available right now, but we need higher paying jobs. We need jobs that have longevity for people, that help bring people out of poverty and up to middle class, right, or greater.
No doubt.
And so we're hoping to work through that. But when it comes to education, we want to see more options for families and students. And it's not just about the funding stream. We've got some things to work on there, but boldly, we don't want zip codes to determine where someone goes to school. So it's getting rid of the lines, and also the supply side. The increase of micro schools, charter schools, learning pods.
Yep. All popular. Big time in Florida, as you well know.
Yeah.
Arizona as well. We could, and
West
even
Virginia.
neighboring Louisiana has had a lot of success with that. Starla, appreciate you coming on.
Sure.
Really enjoyed the conversation. We'll probably see you and the folks down at the Capitol here in a couple of weeks during the session. You and yours have a blessed, happy, healthy, Merry Christmas and a good New Year. Thanks.
Merry Christmas.
Yep. Coming right back on Middays.